The arch of the aorta is divided into left subclavian artery on the furthest left common carotid, and on the right the brachiocephalic, which divides shortly after into the right subclavian and right common carotid. As far as the head and neck are concerned, the right and left common carotids and the right and left subclavian all supply branches in the head and neck. In the subclavian, one of the most significant branches is the vertebral artery. And this travels up through the vertebral foramina of the cervical vertebra. Then the thyrocervical trunk and costocervical trunks come up to supply deep areas in the neck, and in the case of the thyrocervical, the goes up to the thyroid gland. So you have common carotid going up to superficial temporal, and the facial, as we already know about, vertebral, entering in the foramen magnum and supplying the posterior parts of the brain, thyrocervical up as far as the thyroid, and coracocervical going all the way up to the occipitalis. Sorry, that's costocervical. And it's the costocervical that supplies most of the intercostals of the neck. Now, for simplicity, I've represented the thyrocervical and the costocervical as single arteries, but they're actually trunks of multiple arteries that anastomose. Where the external carotid artery is concerned, it's divided about here, with the internal one going up into the carotid canal, into the cranium itself, and the cavernous sinus. The cranial nerves are all very closely related to the external carotid artery. So consider this side section of the face here, with the external carotid coming up here, the common carotid a bit further down, internal jugular next to it, which later will branch off into the retromandibular vein. The superior thyroid artery branches off and back down again. It has a branch to the larynx, hypoglossal nerve coming across the top, and the lingual artery just branches off the carotid slightly above it and then dives again beneath the nerve. Then above this, the tortuous facial artery comes across. The difference between the facial and maxillary is that the facial used to be called the external maxillary, and there were two branches. The internal maxillary is now known as the maxillary artery. They both follow roughly the same course, but either sides of the bone. The venous drainage pattern is relatively similar, with a vertebral vein coming off the subclavian vein just before it goes into the superior vena cava. But the internal and external jugular veins both come separately off the subclavian vein. Now, a lot of the blood from the brain drains into the superior sagittal sinus, or into any of the other various sinuses that go around the skull. From the superior sagittal sinus into the transverse sinuses, sigmoid sinus, superior petrosal, cavernous sinus. Now, because of the anastomoses, the direction of venous drainage from these sinuses doesn't actually matter, and it can vary between individuals. Now, within the falx cerebri, the superior goes along the top, and the inferior sagittal sinus goes underneath, deep to it, at the other end. And there are no valves in any of this cerebral venous circulation, so the blood flow travels in the direction of pressure. The facial vein comes right diagonally across the face, starting with the ophthalmic veins around the eye socket. It eventually ends up in the internal jugular vein. Inside the skull, the cavernous sinus, which is approximately here, also drains ultimately into this vein. And the cavernous sinus drains via the retromandibular vein, which travels through the substance of the parotid gland. And the name comes from the fact that it goes down the border of the mandible. Now, there may be a number of anastomoses within this region that mean that the retromandibular vein or facial vein can drain into either the internal or external jugular veins, which pass next to each other, but at either side of the cranial cavity. The external jugular runs along the course of the sternocleidomastoid muscle. In some people, there's an anterior jugular vein as well, which may be on one or both sides, coming from the veins in the chin and neck. Another variation is that sometimes you can end up with multiple vertebral veins. Now, usually everyone's got the ones going through the vertebral foramina, but sometimes they come up the side as well, and the front of the vertebra. With the exception of a few valves in the valves in the bottom of the jugular vein and the subclavian vein, that's it. There's no other valves in the cerebral venous circulation.